Hello everyone, welcome to my channel Human Health Info. Today we will discuss about male infertility. Please watch the full video to understand everything. Male infertility overview. There is 15% of couples who are unable to conceive or infertile. Even though they are trying for 1 year or longer by having frequent sex without protection, still they are unable to conceive. Male infertility has a role in over a third of these couples. Males are similarly affected by the infertility like females. In some cases both male and female is infertile. Male infertility can occur because of many factors, but it also has many available treatments depending on the cause. Don't be stressed or frustrated because the success rate of male infertility treatment is very higher. Symptoms. The inability to conceive a child is the main sign of male infertility. No other signs or symptoms are present. However, there may be some signs or symptoms because of an underlying problem like hormonal imbalance, inherited disorder, veins divided around the testicles, or a passage blockage of sperm. Still, most infertile male don't notice these symptoms. They are able to understand when they get inability to conceive a child. Male infertility includes these signs and symptoms: problems with sexual activities, having difficulty in ejecting semen or volumes of fluid ejaculated is small, reduced desire of sex, or having difficulty to maintain an erection for satisfaction. In the area of testicles, have pain, swelling or a lump, frequent respiratory infections, inability to smell something, growth of breast abnormally, gynecomastia, facial and body hair decreased, or any other signs that indicates abnormality of chromosome or hormone. A count of sperm is lower than normal. Per milliliter of semen contains less than 15 million sperm, or total count of sperm in per ejaculate less than 39 million. When to see a doctor. If you have tried for 1 year or longer by having frequent sex without protection, still you are unable to conceive, then you should see a doctor. Otherwise, if you have any problems with erection or ejaculation, desire of sex is low, or other sexual problems, then you should also see a doctor. For other reasons also includes to see a doctor is feeling discomfort, pain, a lump or swelling in the area of testicles, and a history of groin, testicle, penis or scrotum surgery. If you have any of these problems, you should see a doctor immediately, then doctor will handle the problem. Cause. Since male fertility is a complicated process, so the following need to occur to make your partner pregnant. You need to produce healthy sperm. During puberty, male reproductive organs growth and formation is involved in this. Initially, to trigger and maintain sperm production, testosterone and other hormones need to be produced by your body, and at least one of your testicles need to function properly. Sperm needs to be carried into the semen. Before mixing with semen and ejaculating out of the penis, sperm needs to be transported by delicate tubes. After sperm production in the testicles are completed, there needs to be enough sperm in the semen. Fewer than 15 million per milliliter of semen or fewer than 39 million per ejaculate is considered as low sperm count. The chance that your partner's egg will be fertilized by one of your sperm get decreased if your semen doesn't contain enough sperm or low sperm count. Sperm must be functional and movable. This sperm may not be able to reach or fertilize your partner's egg if the movement, motility, or function of your sperm isn't normal. Medical causes of male infertility. Several number of health issues and medical treatments can cause male infertility. Some of them are: varicocele. The testicle gets drained by swelling of the veins is called a varicocele. Between all reversible cause of male infertility, it's the most common. Varicoceles causes infertility for which reason that is unknown. Testicular temperature regulation abnormalities may related to this. The quality of the sperm get reduced by varicoceles. Sperm number and function can be improved by treating the varicocele. When using assisted reproductive techniques like IVF, the outcomes may potentially improve. Infection. Sperm production and sperm health can be interfered by some infections. The passage of sperm also get blocked by infections that make scars. Some infections are gonorrhea, HIV, sexually transmitted infections and inflammation of the epididymis or testicles. Although the testicular can be damaged permanently because of some infections, sperm can still be retrieved usually. Ejaculation problems. Rather than being thrown out by the tip of the penis, during orgasm semen enters into the bladder. This condition is called retrograde ejaculation. Several health issues such as diabetes, medications, spinal injuries and bladder, prostate or urethra surgery can cause this condition. Also in spinal cord injuries or certain diseases like this, semen can be ejaculated by some men. Still sperm can be produced by them and can be used for assisted reproductive techniques by retrieving the sperm. Antibodies that attack sperm. Sperm get identified as harmful rather mistakenly by immune system cells or anti-sperm antibodies, so they attempt to eliminate the sperm. Undescended testicles. The testicles normally contained by the sac to descend from the abdomen into the sac. One or both testicles get filled during the development of fetal in some males. In those men who are affected by this condition, fertility can be decreased. Hormonal imbalances. Disorders of the testicles themselves can result in fertility. Hormonal systems including the hypothalamus, thyroid, pituitary and adrenal glands can be affected by any abnormality. A several number of possible underlying causes are responsible for low testosterone and other hormonal problems. Sperm transporter tubules defects. Sperm carried by many different tubes. Trauma, prior infections, inadvertent injury from surgery can be the cause of blocked tubes. Abnormal development such as cystic fibrosis or similar inherited conditions can also make blocked tubes within the testicles, in the tubes that drain the testicle, in the vas deferens, in the epididymis, near the ejaculatory ducts or in the urethra are the places where blockage can occur. Chromosome defects. Instead of one X and one Y chromosome, in which a male is born with two X and one Y chromosome, is called Klinefelter syndrome. Male reproductive organs may develop abnormally because of this condition. Cystic fibrosis, Kallman's syndrome and Cardiganer's syndrome are the other genetic syndromes that can cause infertility. Problems with sexual intercourse. These can include premature ejaculation, keeping or maintaining an erection that is sufficient for sex, painful intercourse. Hypospadia is where the opening of urethra is on the underside of the penis, and anatomical abnormalities, psychological or relationship problems that interfere with sex are also included. Celiac disease. Sensitivity to gluten can cause a digestive disorder called celiac disease, and male infertility can caused by celiac disease. After following a gluten-free diet, fertility may improve. Tumors. The male reproductive organs can be affected directly by cancers and non-malignant tumors. Hormone related to reproduction released through the glands such as pituitary gland or through unknown glands can be affected. Male fertility get affected by surgery, radiation or chemotherapy to treat tumors. In some cases, certain medications. Sperms can be impaired and male fertility can be decreased by long-term anabolic steroid use, testosterone replacement therapy, some ulcer drugs, certain antifungal medications and other medications. Prior surgeries. Vasectomy, scrotal or testicular surgeries, prostate surgeries, inguinal hernia repairs and large abdominal surgeries performed for testicular and rectal cancers may prevent you from having sperm in your ejaculate. To retrieve sperm directly from the epididymis and testicles or to reverse these blockage, surgery can be performed in most cases. Environmental causes. Sperm production or sperm function can be reduced because of overexposure to certain elements such as heat, toxins and chemicals. More causes are industrial chemicals. Low sperm counts may cause by extended exposure to toluene, pesticides, xylene, benzene, organic solvents, herbicides and painting material. Heavy metal exposure. Infertility may also caused by exposure to lead or other heavy metals. Overheating the testicles. Sperm production and function get impaired by high temperatures. Although the studies are limited and not included, sperm count may temporarily impaired by the frequent use of saunas or hot tubs. Your sperm production may slightly reduced because of the increased temperature in your scrotum. Temperature in your testicles can be increased because of sitting for long periods, working on a laptop for long periods and wearing tight clothes. Radiation or X-rays. Sperm production can be reduced by exposure to radiation, though it will return to normal eventually. But production of sperm can be reduced permanently with high doses of radiation. Health, lifestyle and other causes. Weight. Fertility can be impaired in several ways by obesity. Male fertility can affected by obesity because it directly impacts sperm and causes hormonal changes. Use of drugs. Testicles can be shrinked and production of sperm may decrease because of anabolic steroids that is taken for stimulate muscle strength and growth. The number and quality of your sperm may reduce temporarily because of the use of cocaine or marijuana. Alcohol consumption. Erectile dysfunction and decreased sperm production can be caused by lower testosterone levels that cause because of drinking alcohol. Excessive drinking can cause liver disease and this may lead to infertility. Tobacco smoking. Those who doesn't smoke have a higher sperm count than those who smokes. On the other hand, male fertility also may be affected by smoking. Emotional stress. Certain hormones needed to produce sperm may get interfered by stress. Sperm count can be affected by severe or prolonged emotional stress and problems with fertility. Depression. If a male partner has severe depression, the chance of pregnancy may get lower, showed by research due to reduced sexual desire, erectile dysfunction and delayed or inherited ejaculation. Sexual dysfunction may caused by the depression in men. Prolonged sitting. A risk of infertility may be associated with certain occupations, those involving prolonged sitting such as welding, truck driving, etc. However, the research is mixed to support these links. Risk factors. There are many factors that can lead you to male infertility. If you have the following issues listed below, then you're at a high risk. If you smoke tobacco, if you drink alcohol, if you take certain drugs that are illegal, if you are obsessed to toxins, if you are overweight or underweight, if you are stressed or depressed, if your testicles are overheated, if you have experienced any testicles trauma, if you have a history of undescended testicles, if you have a history of major abdominal or pelvic surgery, if you had any infections on the past or having in present, if you have any genetic fertility disorders, if you have or had tumors and chronic illness like sickle cell disease, if you are taking any medication of cancer or undergoing medical treatments like surgery or radiation for cancer. Complications. Both you and your partner can be stressed because of infertility. Sometimes there may be some complications such as your doctor may need to do surgeries or other procedures to treat your reproductive problem like low sperm count or other underlying cause. Sometimes treatment can be expensive and needs reproductive techniques. The inability to have a child can make you and your relationship with others stressed or more difficult. Prevention. Though the type of many male infertility can't be prevented, still you can try to prevent it by avoiding some known causes that are responsible for male infertility. Those causes are listed below. Avoid smoking. Limit your consumption of alcohol. Don't take any kind of drugs that are illegal. Maintain a healthy weight. Avoid those things that can make your testicles overheated. Reduce all kind of stress. Avoid chemical exposure like pesticides, heavy metal and other toxins. Diagnosis. More than one causes can be involved in many infertile couples. You and your partner both needs to see a doctor to find out the cause of male infertility. Several number of tests might need to take a cause remain unfindable in some cases. The test to diagnose male infertility can be expensive. Following procedures may be done to diagnose male infertility: physical examination and medical history. This is a discussion session where you may ask about your illness, injuries, inherited conditions, chronic health problems, or if you have any history of surgeries that can affect on your fertility. You may also ask about your habits of sex and development of your sexuality during puberty. Semen analysis. By many different ways in a couple, semen samples can be collected. By masturbating and ejaculating into a container, you can provide sample at doctor's office. Alternative method of semen collection can be applied for those who has religious or cultural beliefs. During intercourse, by using a special condom, can collect the semen in such cases. To find out the quantity of sperm, abnormal shape, morphology, and movement, motility, your semen sample is sent to the laboratory. Then, signs of problems like infections also checked by the laboratory. Sometimes sperm rise and fall irregularly in number or amount from one sample to another. To ensure that the results are accurate, semen analysis tests are done several times in different ways in most cases. If results shows that your sperm analysis is normal, then you may ask to test your female partner's health before taking any more infertility test of yours. Other tests to identify the cause of your infertility can be recommended by your doctor are: scrotal ultrasound to produce inside your body images. This test uses high-frequency sound waves. If there is a varicocele, other problems in the testicles and supporting structures can be seen by a scrotal ultrasound to your doctor. Hormone testing. In sexual development and sperm production, hypothalamus, a hormone produced by the pituitary gland and testicles, plays a key role. Infertility can be caused by abnormalities in other hormonal or organ systems also. The level of testosterone and other hormones can be measured by a blood test. Urinalysis after ejaculation. Retrograde ejaculation, or the condition where instead of outing by your penis during ejaculation, your sperm travels backward into the bladder. Urinalysis can detect if there is any sperms in your urine, and if found, it can indicate retrograde ejaculation. Genetic tests. To diagnose various congenital or inherited syndromes, genetic testing might be taken. There could be a genetic cause if the quantity of sperm is extremely low. If subtle changes in the Y chromosome, signs of a genetic abnormality, a blood test can detect that. Testicular biopsy. With a needle, samples from the testicles is removed in this test. If the sperm production is shown normal in a testicular biopsy results, then a blockage or another problem with sperm production can be the cause of your infertility. Sperm function tests. After ejaculation, how well your sperm survive, how well an egg can be fertilized by your sperm, and if there is any problem while attaching to the egg, can be checked by several tests. Generally, in some rare cases, these tests are performed and the recommendations for treatment don't significantly change. Transrectal ultrasound. To check your prostate and looking for blockages of the tubes that carry semen, your doctor may perform this ultrasound. In this ultrasound, a small lubricated wand is inserted into your rectum and allows your doctor to check everything. Treatment. Sometimes the cause of infertility remain unfindable. Your doctor may recommend treatments or procedures that can help in conception even if an exact cause is not found. In infertility cases, your female partner also get recommended for checkup to know if any specific treatments or assisted reproductive techniques is required for her. Treatments for male infertility are: surgery, unobstructed vas deferens repair, a varicocele correction, or reverse prior vasectomies can be done by surgery. Using sperm retrieval techniques from the testicles or epididymis, Sperm can often be retrieved directly, treating infections. Though an infection of the reproductive tract can be cured by antibiotic treatment, still fertility not always restored. Sexual intercourse problems treatments. Conditions such as erectile dysfunction or premature ejaculation can be improved by the medication or counseling. Hormone treatments and medications. If problems with the way body uses hormones or level of certain hormones are high or low causes infertility, hormone replacement or medications can be recommended by your doctor in such cases. Assisted reproductive technology, ART, depending on your specific case and wishes. Sperm get obtained through normal ejaculation or surgical extraction and from donor in ART treatments. Then the sperm get used to perform IVF or intracytoplasmic sperm injection by inserting the sperm into the genital tract of female. When treatment doesn't work, male infertility can't be treated in some rare cases and becoming a father gets impossible for a man. You and your partner may be suggested to adopt a child or using sperm from a donor by your doctor. Thanks for watching. If you like the video, then please like, comment, share and subscribe to my channel.